Okay, everyone, I would like to give our official welcome to the University of Maryland, the Equine and the Maryland Horse Council sponsored Getting Started with Horses in Maryland series to celebrate October's Maryland Horse Month. We're very excited to have you all joining us today, those of you live and those of you that may be watching this recording later. Today's topic is how to select a horse to buy or lease. We're very excited to have with us today Dr. Justin Sobota from South Mountain Equine and Katy Whipple from the Maryland Equine Transition Service. We're very happy to have them. They both have a lot of experience in matching people with their horses and helping people find horses that really suit what they want to be using them for. So we're very excited to learn more about this topic that I think is something that all of us who hope to have a horse of our own really need to learn more about. So with that, we'll be starting off with Katy, and I know that you have some screen sharing to do, so I will stop my welcome slide.
Okay, can you guys see that?
Yeah, you can see it.
Okay. So hi everybody, thanks so much for joining us, and thank you to the University of Maryland for inviting us here. So we're going to talk about some things that you might want to think about when you are looking to buy or lease a horse for yourself. Making the right decision is probably one of the things that is most important. We want to make sure that the horse and human partnership can last as long as possible so that the horses don't wind up in vulnerable situations. We're going to talk about some of the things that might help with that. So I just want to start off with a little bit about me and about Mets. I'm Katy. This goofy dude on here, that's Ukiah, that's my horse. I have been involved with horses pretty much my whole life. I've been involved with Mets since it started back in 2018. And I came on as the assessment specialist last October, so I just passed the 1-year mark as a staff member. METS is a statewide nonprofit program of the Maryland Horse Council Foundation. Our mission is to provide Maryland horse owners with resources to make sure that their horses are safe when they need to transition them. And we'll talk a little bit more about what that means in a little bit. Since METS rolled out in 2018, we've assessed almost 200 horses, and we've directly assisted in placement of about over 100 of those horses. We also like to think that we've indirectly helped with the horses, the other horses that we've assessed. What sets METS apart from the other rescues in the state is that we are a mobile service. So we do not take ownership of the horses in our program. As the assessment specialist, I travel all over the state assessing horses, bringing them into the program, and then we take applications for those horses, we process them, we check references, and then we provide transparent information to the owners so that they can make the best educated decision for rehoming their horse, whatever that transition may look like. So that is one really unique thing that sets METS apart from everybody else. One of our goals is to alleviate some of the pressure on Maryland rescues. And this is a way to do that. We're helping the horses before they might get to the point where they need help from a rescue. This is the METS team. We are a small but effective team. It's the 3 of us. Emily here is our program coordinator. She keeps the program running day to day. She's in charge of a lot of things. And she and I work very closely together. And then Brittany, she is now our program consultant, but she started off as the director of METS. And she is really the one responsible for getting the program off the ground and into the successful program it is today. And it has gone through quite a bit of evolution. It's quite different from the program we set out to start. Okay, so let's talk a little bit, about reasons for transition. So there's a lot of different reasons we see people needing to rehome their horses. It could be anything from financial difficulty to it's just not a good match, the horse, and sometimes you just don't get along, and that's okay. We're here to help that horse find a person that they do get along with. It could be herd dynamics, owner skill, and that could be high or low, right? An owner could be progressing so much that they are looking to go above what the horse might be able to do, or the owner might be more of a beginner than they thought they were, and the horse may be a little too advanced. So we need to keep everybody safe by trying to get a better match. One of the things that METS really prides itself on with this is that we do not judge. Any reason for transition, there is no judgment. If you need to move your horse, we will help you. It doesn't matter why. We are here to help. Our goal is really long-term transitional homes for horses. Horses average changing hands an average of 7 times in their lifetime, so we're trying to minimize that as much as possible. Okay, so segueing into the actual topic here, buying or leasing a horse. So there are pros and cons to both. Buying, you have a lifelong partner. You're in it for the long haul. And when I say long haul, I mean long haul. Horses can live into their 30s and 40s. A lot of people don't realize that when I talk to them, when we talk to the Mets. It is a long-term commitment. When you buy a horse, you have full control over veterinary care, with, talking to your vet over what kind of riding they do, what kind of work, the place where they live. But you also have full responsibility for that. There is some stability when you buy your own horse. You don't risk losing the lease. Having said that, there are multiple options within the lease that might be more tempting, especially for a beginner. There are free lease options, half lease options, and full lease options, and all of those come with different levels of interaction with the horse, how many rides you get per week, what your financial obligations are, and that really depends on you, the horse, and the owner. When you're leasing a horse, it's a really good option for maybe a child rider, because the child might be good on a 13-2 pony right now, but come 2 years, that child might need a 16-2 horse. So when you lease, you can upgrade the horse that you're riding. Let's see. Okay. Another thing that we find people sometimes don't have a full grasp on is really the cost of horse ownership. The cost of the horse itself is often the cheapest part, especially, going through mats or a rescue where it's either free to a good home or just, a couple $100s. What really can add up is the month-to-month costs, things like board, preventative veterinary care, barrier care, dentistry, wormer, all the tack and the fun things that you get at Dover Saddlery, that all adds up, trust me. Emergency vet care. And yes, you will have an emergency vet call. I'm sure Dr. Sobota will talk about this. You will inevitably have an emergency vet call. Colic surgery, generally speaking, can cost $5 to $10 grand. So you need to be prepared for that if your horse is a candidate for colic surgery. And then there's hay, grain, supplements, treats. There's a lot of costs of horse ownership beyond the initial purchase price. So in the next few slides, I'm going to go over these things: behavior, personality, vices, conformation, and training level. Behavior. So wherever the horse is coming, if it's a boarding barn or your personal barn, you need to think about the herd dynamics that the horse is coming into. When you go to meet the prospective horse, observe that horse. Take a few minutes and watch him out in the field. Make sure you ask the owner to leave him or her out in the field so you can watch how he interacts with the rest of his herd. Is he high in the pecking order? Is he low in the pecking order? Does he come in from the field with any trouble, or is he relatively easy to bring in? How does he interact with the humans that he knows, his current owner, his trainer? How does he react to you, a completely new person? All this information is really valuable in deciding if this horse is going to be a good fit for you, and if you're going to be boarding at the boarding barn. This little graphic I just thought was really cute. It's super oversimplified, but it shows all the different ways horses can show emotion and different behaviors. And this is just the face, right? They have body language with their feet, with their barrel, with their shoulders, with their tails, with their rumps. There's so many different ways to interpret horse body language, and it's important that you get a sense for your horse. And don't be afraid to ask the current owner, why is that horse doing that? Why does he have his ears back? What do you think that means? Because they know that horse better than you do at this point. Related is personality. What kind of personality horse are you looking for? Do you want a horse that is super work ethic? Or would you rather a horse that would just like to kind of laze around on a Sunday and snuggle with you? Horses can be in that spectrum and all kind of different ways that they want to interact with you. When you first meet the horse, was the horse aloof? Did it not seem to care that you were there? Was he nervous? Did he have pinned ears? Or was he bright and curious and maybe hoping you had a treat? Was he trying to play with you? Was he seeking interaction with you? Or was he just like, nah, I'm going to eat my hay over here? These are all really good indicators of how that horse will act once they've settled into their new home. It's not going to be right away, right? Because horses need an adjustment period when they're creatures of routine. So when you break up their routine, even if it's a good change, there's going to be an adjustment period. So the more you can observe at the current home, the better. It'll give you a much better idea of the horse. So vices. Vices have a bad rap, and with good reason. Some of them are not great, but many of them don't have to be a deal breaker. Weaving, cribbing, bucking, rearing, some of these are more dangerous than others, but a lot of them can be managed, especially if you are with a good trainer. One thing to note about cribbing is you need to check with your boarding barn if you're going to be boarding, because many boarding barns do not allow cribbers on site. This is a refrain that I'm going to be saying a couple times. Talk to your trainer, talk to your boarding barn. Use the people who are professionals in the industry that know you and know this horse, and listen to them. They will be able to tell you if the vice that this horse apparently comes with is something that is a deal breaker or not. Okay, so conformation. This is a huge topic, so I'm just going to be really kind of just on the surface with this. Conformation could be an entire webinar, Jennifer, if you ever wanted to do a webinar just on conformation. It's really the evaluation of the shape and structure of a horse. So is he behind at the knee, forward at the knee, long back, short back, any of those things. As with vices, a conformational defect isn't necessarily a deal breaker. It depends. What kind of work do you want to do with your horse? What kind of turnout is the horse going to have? All of these things make a difference as to the decision that you should make. Conformational weaknesses can lead to soundness down the road, but again, it depends what kind of work the horse is going to be asked to do and what that conformational defect might be. Some really basic examples. In dressage, if you choose a horse that has a longer back, he might not be able to be as successful in dressage because he won't be able to collect underneath himself. It doesn't mean he never will be able to, but it will be harder for him. If their front feet are pigeon-toed or toe out, that might cause some gait disturbances, which might affect equitation scores. A downhill build, which is when the shoulders are not as tall, the withers aren't as tall as the hind end, might make it more difficult for horses to clear jumps. Again, none of these are absolute deal breakers. Talk to your equine professionals and get their opinion on the conformation of the horse you're interested in, and see if everything else is hunky-dory, then can you live with this one little thing that may or may not affect them. I wanted to do a slide just on feet because I think hoof health is really overlooked by people looking at horses. And I've seen in farrier circles the no hoof, no horse. And it's true. If you have 4 feet, you don't have a horse, right? So you really want to listen to your equine professionals. There it is again. Talk to farriers. If you have a farrier at the boarding barn, ask if you can talk to them. Take pictures of the horse's feet and ask your farrier for advice. Is the horse barefoot? Is he shod? If he's shod, does he have shoes on both front feet or all 4 feet? Does he need corrective shoeing? All of these things not only affect the monthly or bi-monthly cost, depending on how often the farrier needs to come out for him, but it also affects what he may or may not be able to do. There are breed-specific hoof needs. I don't really like to generalize, but thoroughbreds, generally speaking, don't have the best feet. There are definitely exceptions, but a lot of thoroughbreds can have weak feet. Ponies are really susceptible to laminitis and to founders. Quarter horses can be susceptible to laminitis too. These are things that you should be aware of and be looking at when you go to look at your horse. Are their feet in good health? Are there any cracks? And are they long, or do they seem like they're trimmed regularly? And training level. This is my final slide. Yeah. So this little ditty at the beginning, this is Brittany's thing. Green plus green equals black and blue. You need to be honest about your ability, right? If you are a green rider and you get a green horse, one of you is going to get hurt. It's just going to happen that way. Same if it's a young rider and a young horse. There's probably going to be some bumps and bruises there. So be realistic about your ability. Bring a trainer with you who knows you as a handler and a rider. Listen to what they have to say about you and about the match that might be there. When you're looking at a horse, it's important to think about what you hope to be doing with that horse in 1 year, 5 years, 10 years. You know, you might be dreaming of Grand Prix jumping or doing a P-off, whatever it might be, or a 5-star up at Fairhill. But what it comes down to is, what rider are you now? And will you be able to safely handle this horse? That is what keeps you safe and keeps the horse safe. Because when a horse is not matched well with its person, they're more likely to be put in a vulnerable situation. One important point here for training level, and this really talks to everything I've discussed so far, is ask the owner to ride the horse first. You can get a really good idea of how the horse moves, of any kind of quirks while they're being tacked up or ridden. It's also a really good kind of test. If the owner refuses to get on the horse, you need to ask why and figure that out. It's a potential red flag there. And invest in training for your horse and yourself. Those equine professionals, again, they are your best friends with this, with making your partnership with your new horse a success. Listen to the people who know you and know your horse, and really, you know, invest in that. That is how you're going to make this partnership long-term, is by investing in learning for both you and your horse in the long term. So that's kind of it. So thank you for listening. I'm happy to answer any questions. I apologize if I went too fast. I tend to talk too quickly. So I'm happy to answer any questions or anything like that.
Thank you, Katie. That was a great overview. And yes, if any of our participants have a question, please go ahead and put that in the chat if you have something that you think of now for Katie, or if something comes up along the way. Before we move on to Dr. Sobota, though, I was wondering, Katie, could you maybe tell us, when you do an assessment of a horse that's coming in for mets, you know, to get an idea of what it is capable of or not capable of, like how does that work? Like what happens when you go to look at a horse and you're trying to see what it may or may not be able to do? Can you talk us through that process?
Yeah, so it really depends on the horse and the current owner. Sometimes we have rideable horses that the owner isn't available to ride, and we ask for video from previous rides if possible. It really depends. We strive in each assessment to see how the horse comes in from the field. We specifically ask owners to leave the horse turned out until we get there, so we can see them coming in away from their buddies, So we can see them being cross-tied or straight-tied or ground-tied. So we can see them getting groomed and tacked up. So we can see them walking in hand, trotting in hand, lunging, whatever the horse might be able to do, we ask to see samples of that. If the horse can be ridden, we try really hard to get somebody to ride the horse then and there. It doesn't always work. It just depends. A lot of times our owners just maybe have a health problem that means they can't ride anymore, whatever it might be. And we are transparent about that in our listings. And when people inquire about those horses, we are upfront about that. You know, this horse is rideable, but we haven't seen it go. We've seen it lunge, but we haven't seen anybody get it on its back. In that case, we would recommend that if an applicant gets to the point where they're going to meet the horse, we would suggest that they bring their trainer and see if their trainer is allowed to get on the horse so that they can have a better idea of how that goes.
So anyone who was looking for a horse, whether it was through your organization, through METS, or through even a private sale, those are things that they could do as well, or ask to do from the seller to be able to see how the horse is and all of those various
Absolutely.
settings.
Whether it's private sale, through a rescue, through a broker, through us, we highly recommend a PPE, which I'm sure Dr. Sobota is going to talk about now. And we recommend that they see the current owner and or trainer get on the horse. It's the best way to make sure that you have a really good idea of the horse that you're potentially bringing home, so that you can be set up for success with this animal. So that, 1 or 2 years down the line, you're not emailing us asking for rehoming. We're more than happy to help you if you do, and no judgment at all, but we're trying to make long-term connections so that everybody is transparently educated about the animal and about the new owner and about how they can work together.
We did have a question come in, and the question is, when going to buy a horse, should the buyer ride the horse first to see how comfortable they are on that horse?
I would recommend the current owner ride first, and then yes, absolutely. If you feel comfortable getting on that horse, with or without your trainer there, then you should. I would recommend that you get on the horse, because you can tell a lot by sitting on the animal's back. So if you feel that it is safe, then by all means, for sure.
Great, definitely. If anyone else has any questions, please go ahead and pop them in the chat. Katie is staying on with us, so even though we'll move on to Dr. Sobota's portion of the presentation, you're welcome to put in questions that you have for either of our presenters today. So I'll turn it over to you, Dr. Sobota, and let you tell us a little bit about what that pre-purchase exam means and anything else that you would suggest when you talk to your clients about buying a horse that may be brand new to them, or if they're new to buying a horse, they're new to looking at a horse to lease, what would you want them to know and think about?
Thank you, Jennifer. Thank you, Dr. Burke, and thank you, University of Maryland Extension. I appreciate this opportunity to speak about pre-leasing and pre-purchasing an animal, the horse of your dreams. And so we want to talk about some of the questions beforehand and maybe what the goal of a pre-purchase exam is. I really enjoyed Katie's presentation. I think she provided a lot of good information to think about even prior to calling your veterinarian or a veterinarian who might help you with a pre-purchase exam. So we do pre-lease exams as well as pre-purchase exams. I think it's important for a veterinarian to examine each animal individually and as extensively as possible, no matter what the intended job for that horse is. So whether it's a barrel racer or an eventer or a backyard buddy, I think it's really important to really be thorough. And I think that's something that you want from your veterinarian who may do a pre-purchase for you once you decide on that animal. The goal of a pre-purchase, really you have to ask yourself, what's the goal? And for you, it's to minimize the risk and to help protect your investment. That's what you're looking for. As a veterinarian, my goal for a pre-purchase exam oftentimes is to identify where the problems are. Does this horse have any pain in particular? Does it have a behavior issue? Or Could it be both? And really, I think that's our job at the end of the day, whether it's a pre-purchase or a lameness exam or exam in general. We're really trying to identify, is there pain, behavior, or both? So that's my goal always when I enter a pre-purchase exam. I think some of the myths about pre-purchase exam is I'm looking for that perfect horse, and there is no perfect horse. We need to match you, as Katie was saying, we need to match you with your skills and ability, with the skills and ability of this horse that you're looking at. Nowadays, we don't like to pass-fail horses anymore, right? There is no perfect horse, so we want to make sure that we are outlining and providing you all the assessment that we can in evaluating this animal. I know a friend of mine who actually looked at probably 10 horses before they purchased a horse and did multiple pre-purchase exams. So when you go to that pre-purchase exam, I know there's a lot of anticipation, there's a lot of desire, but be careful, be cognizant of your decisions, and really try to listen to your veterinarian. I'll talk a little bit more about that as time goes on here. I think another thing that you should always consider is don't bring the horse trailer to the pre-purchase, because it may not happen. Don't psych yourself up. But that's just a little thing that we think about as veterinarians. I think for you as a buyer of a new horse or leaser of a new horse, you're going to have questions for both the owner as well as the veterinarian. And so when you're looking for a veterinarian, you really want to try to avoid someone who may have bias in this examination. So looking for a veterinarian who may not be doing the routine work on that animal is probably a good idea. So if I was out doing a lot of immunizations or have done lameness work on this horse, I should not be the one providing the pre-purchase exam for you on that day. Look for someone else. Try to find someone who doesn't have a bias or an interest potentially, and try to keep these awkward situations limited. Ultimately, what skills and or equipment does the veterinarian have? Do they have digital radiography? Do they have digital ultrasound? Do they have gastroscope? What are their other skill sets? Do they have some skill sets in chiropractic or acupuncture or some other skill sets, or maybe they're boarded in a certain specialty? So look for those things. How do they line up with what you're doing and with what your interest is? I think it's also important when you're looking for a veterinarian that they're willing to share information, maybe with your routine veterinarian or the farrier, and really try to work together as a team. And that's a special thing that we try to do within the industry, I believe, is really, of course, trying to do our best, but really work together as a team. That's important. Is this veterinarian willing to share x-rays? Are they willing to share a report, et cetera, with your routine veterinarian or whoever you might be working with? There are certainly questions for the seller. So those were questions for the veterinarian when you're looking for a veterinarian, but there should be some questions for your seller as well. Simply, why are you selling this horse? How long have you had this horse? Are you willing to send the horse out on trial? Has the horse been lame or had any colic episodes? Does this horse have any vaccine reactions or any other medication reactions? Does the horse have any vices, as Katie was asking about? And certainly it doesn't mean this is a bad horse, but we want to know, does it crib, does it weave, does it stall walk? And certainly behavior issues such as bolting or bucking, and certainly the horse's current workload and experience. Some of these things may be figured out during the pre-purchase, or you might have to go in more detail or more depth during that pre-purchase exam if you want to know some of these answers. But it's worth asking the seller. Now, if someone calls us for a pre-purchase examination, we actually have two forms on our website, and I think it's important for us to kind of delineate this. We have a pre-purchase form for the buyer, and we also have a pre-purchase form for the seller. I know Katie really did a nice job asking earlier, what is your intended use of the horse? What is the past or current use of the horse? And these are questions that we have for you as a buyer. So we like to have this information before we enter an exam, and then we'll also get information from the seller as well. And we try to mesh this together so that when we go into that pre-purchase exam, we really have a full understanding of what our objective is. So certainly on the pre-purchase form for you as a buyer, intended use of the horse, the current use of the horse, What is the age, size, and ability and experience of the intended rider, you yourself? Honesty. I really think that's important. And Katie mentioned that earlier. What is your ability? What do you want to do? And as a veterinarian, I always try to express that being honest is important. And when you're looking at this animal, trying to be honest and saying, yes, this is what I see. This is what our objective information that we have. And then ultimately we can try to make some decisions. But honesty is really important when you're filling out this pre-purchase buyer form. How long have you known the horse? How long have you tried or ridden the horse before the exam? It sounds funny, but we have people from states other than Maryland call us for a pre-purchase exam, and they may have never ridden the horse. All they see is a video, maybe a picture online. It's a more challenge, I think a little bigger challenge sometimes when you don't have that experience, where you haven't had the opportunity to ride that horse and be on that horse. So we do some of those, but it is a nice thing if you can ride that horse or be with that horse for some time before you decide to pre-lease it, pre-purchase it. We always rate some things in relative importance as well. I like to try to find from you, is the appearance really important? Is performance really important? Or is temperament really important? And you may be a novice rider and temperament is maybe the best thing. You may be a 5-star rider and that performance is the biggest thing. And the temperament is not as a priority, and that's okay. So we have to try to prioritize these important issues. How do you rate the suitability of the horse for the intended use is another good question. And then of course, what type of care is provided? So are you going to be able to provide intensive care, average care, or casual care, or they're just out and about in a pasture? And that's all okay, but we try to identify some of these questions first before we go in. For a seller pre-purchase form, really is a disclosure form. I want to know from the seller all previous medical record history. And I think it's a challenge sometimes for veterinarians to ask for that, but we really want to try to get as much information as we can prior to the examination from the seller. So what kind of routine care, what kind of medications have been provided? Has there been any imaging or injections being provided? So these are some general questions that we like to ask the seller. We really want to have that medical record history. And we will typically ask then for a signature, make sure that we feel that they are being honest with us. So, all right, we made it through all of this paperwork, and now we're setting up an appointment. We go out to the farm. All right, how do we provide a pre-purchase exam? Most veterinarians are taught that there should probably be a passive examination and then an active examination. So during this passive examination, and it may be in a stall, I typically work in a stall initially, where I'm looking at this horse from ear to tail, and we're going over every little bit of this horse as much as we can. And so we use the tools that we have in our tool bag, and that may be an ophthalmoscope to look at the eyes, it might be a light to look in the ears, it might be a hoof tester to look at the feet, it might be just our hands feeling the belly and making sure that this horse has not had surgery. And certainly we'll do a neurologic exam as well, where we'll take him out and we'll do a neurologic exam. So we're trying to go over this horse from ear to tail prior to even the active examination, prior to even watching this horse trot. So let's say we feel that we've done a good job with that. And I'll say that some of the other tools that I use in particular are chiropractic or spinal manipulation tools, where I'm feeling the horse's back or pelvis maybe a certain way, or even some acupuncture work where I'll try to do what we call an acupuncture scan, feeling over the back and certain acupuncture points. So these are things that veterinarians have as tools that we try to incorporate into our passive exam. All right, say we've done really good and we've gotten through that passive exam. I feel good about this horse. We're going to go to the active exam. And this really is our gait analysis. And we're going to look at this horse at a straight line walk, straight line trot, and then we may even lunge the horse prior to doing any what we call flexions. And so ultimately, that's kind of where the rubber meets the road sometimes is with flexions in certain animals. And so what we'll do is we'll do what we call a lower limb flexion or an upper limb flexion, and we're flexing certain joints for a certain period of time, usually 45 seconds to a minute, something of that nature. And then trotting the horse off and really trying to do a good gait analysis, identifying is there any pain or discomfort when we flex this horse's joints. So really important to do that during the exam. We'll do that both in the front limbs as well as the hind limbs. And there are multiple different flexions that we're trying to do to see if there's some discomfort. All right, now let's say through the passive exam, the active exam, and say, okay, this hock might be a little sore, or this foot might be a little sore. Now what? Well, nowadays we have such great imaging tools on our truck, including a digital radiography units or digital ultrasound, that we can start looking at some of these joints or bones or tendons or ligaments to make sure that everything's happy and healthy. Or is it something that we can live with? Is there maintenance that we can provide this animal to make sure it's comfortable? So, as I said, radiographs and ultrasound are certainly easy things that we can bring out. When it comes to x-rays or radiographs, most commonly we are looking probably at the feet, as Katy said, no foot, no horse. So we will do some balance films, what I call farrier films, and basically it's two projections of each foot, where we're looking at a lateral to medial and a dorsal to palmar or front to back view of the foot. And so we like to look at feet and try to share that with the farrier oftentimes. Oftentimes we'll look at hocks or fetlocks or knees or carpusses or stifles. These are all things that we can image. Nowadays, it's becoming more and more common now to even look at backs and necks with x-rays and or ultrasound. So these are things that you may want to think about as you go through the pre-purchase exam. And this is a conversation you have with your veterinarian as you're going through this active exam or the passive exam, and if there is a question. So we're able to do radiographs, and we're also now able to do ultrasound. So if you have, let's say, a thickening of the superficial digital flexor tendon on a front leg, we can take a look at that with ultrasound and try to help say, is this an acute or a chronic problem? What's the likelihood of success in the future? And so we are trying to look into our crystal ball a little bit, I think, clinically when we're at the exam, but at the same time, we're trying to be objective. The nice thing now with a lot of our imaging technology is that we can send these films out and have a board certified radiologist look at them, and gives you a little extra certainty, especially if you're doing an expensive pre-purchase. It's probably worthwhile to have a board certified radiologist, equine board certified radiologist, look at some of these films and or ultrasounds. Other exams that may happen would be a gastroscope or even an upper airway exam. So if this horse is having some difficulty breathing, or it's where we're seeing or hearing an audible sound, we may want to do an upper airway endoscopy and look at some of the structures in the upper airway, and that may be something you have to even postpone to another day, and that's okay. Or a gastroscope where you know that this horse has had Gastrogard, a stomach medication, for 30 days, 6 months ago. What does the stomach look like now? It may be something that we have to do at a later date because we have to fast the animal. But these are some other tools in our tool bag that we can use to try to evaluate your pre-purchase animal. Ultimately, when we get all of this completed, we will provide a written report. And I think that's important to have a written report from your pre-purchase exam veterinarian. It can help in a number of ways. Ultimately, we're going to give you a level of risk or management, and whether or not you're willing to accept that. You know, this horse may need to be on special joint maintenance or bone maintenance medications or stomach maintenance medications. So is that something within your budget? Is that something that you can provide this horse for optimal health and comfort? I do want to say a little bit about blood tests as well. Sometimes I'll look at an animal, and sometimes we'll do blood tests. There's what we call an endocrine panel, looking at certain hormones. Does this horse have insulin dysfunction? Does this horse have Cushing's or some other issues that may be underlying? So there are some blood tests that can be completed. Those blood tests also include a complete blood count and chemistry, and sometimes we'll even do a drug screen. Certainly if this is off a level performance horse and we're not sure of the situation, we may want to do a drug screen. Oftentimes we'll draw that blood and we'll actually put it in the freezer for future needs if necessary, or if it's something that you want to do, you can certainly do. And there's different levels of drug screening that can be done. Those are some things that we think about with blood tests. And oftentimes I'll draw that blood actually in the beginning, even during that passive examination, just be one of the first things that we want to do. And then, as I mentioned, we want to do a written exam, or I'm sorry, a written report. We'll usually send that out to you in a day or two once we're done with the examination. Feel free to always ask your pre-purchase veterinarian prior to the exam, what is the cost? There is kind of an average cost of a lot of these pre-purchase exams. Understand what the costs are of some of these things. We should always be upfront with you about the costs of all of the diagnostic tools that we have available. And certainly understand it does take time to do a good pre-purchase exam. At least allow for a couple hours for a pre-purchase exam. It's an exciting time. We want to do our best to help you. And that's a little bit about the way we weave through our pre-purchase exam. And certainly if you have any questions at this time, I'm more than happy to help you with some questions, but I wanted to at least start with that. There are so many things that we can talk about, just as Katie was talking about conformation. It's something that we look at, of course, during our passive exam. There's a lot of other things that we're looking at, but if there are some general questions or even non-general questions, happy to help you with those at this time.
We do have one question that has come in that is, what would you consider, and I would edit that to say, are there anything that you would consider to be a deal breaker when buying a horse?
Oh, great question.
No feet.
I would say I'm sure that in a lot of cases it depends on the intended use of that horse. What's a deal breaker for something that's coming in just to be a companion and eat grass, it would be very different from what might be a deal breaker for something that you are looking at for a more highly competitive horse. This person's question says, how about a young horse for dressage? So if you're looking at a young horse as a dressage prospect, are there particular things that you would want to see or not want to see?
Yeah, that's a great question. I think the first question, are there any deal breakers? Certainly if there was maybe a fused joint of some sort where the rider wanted to use this horse for a trail horse or dressage horse, and we saw a fused joint of some kind or a really bad arthritic joint, that may not be the horse. And it's not necessarily a deal breaker, it's just maybe not the right person for this horse. And so we do have to consider some of those things. And as Katie said, horses live until 34 years. So there's a lot of time to think about. For a young dressage horse, certainly if you're looking at a young animal, then a young horse for any discipline summary, we're looking at what has genetics provided this animal, what has nutrition been like for this animal for the first few years, what has been the training of this animal for the first couple of years. All of those things combined can cause certain issues, and certainly in joints we look for what we call OCD lesions oftentimes, and those are lesions within the joint, within the joint that can be somewhat limiting. So X-rays can really help identify OCD lesions. Doesn't mean that they cannot be removed, doesn't mean that surgery is not an option, but you need to know that prior to the exam. And certainly if you see certain things of that nature, that may provide you a negotiation tool in what you're trying to achieve that day. But there's always risk, of course, with surgery, and always risk in buying a horse, but we want to limit and minimize your risk. That's the goal of pre-purchase.
So moving forward from, looking at a very young horse and what you might want to really consider and be aware of in looking at a young horse to purchase, what about when you're looking at an older horse, more of a schoolmaster type that you're looking at? We often recommend that people who are brand new to horses buy or lease one of these older schoolmaster type horses. What are some considerations for that purchase of an older horse?
Great question. I think one of the first things I certainly look at or think about is endocrine health. Does this horse have Cushing's at this point? Does it have some insulin dysfunction? So thinking about some blood tests during that pre-purchase may be a really helpful thing, so that we can at least get them on some medications to help some of these endocrine disorders. Ultimately, has that animal had any soft tissue injuries or joint bone injuries that we need to consider as that can limit performance? But there are so many great schoolmaster horses out there, and we can live with a lot of these things. And so we're trying to improve the quality of life for these animals, and certainly have a good partnership with you. But certainly getting them on certain medications if they have some endocrine disorders, or saying, hey, these hocks or this coffin joint is really arthritic and it's going to need some maintenance. And these are the medications or injections, a variety of things that we can do to help. Because, yeah, older horses are great. And I think that they provide a ton of value for a novice young rider. But understand that there is additional maintenance typically in some of these older horses, and that's okay. We just need to understand and have that expectation.
We had another great question come in, as we see a lot of folks now really understanding the abilities and the great attributes of off-track thoroughbreds. So what about the pre-purchase of an off-track thoroughbred? The question is specific to tendon injuries, but I would say, because we are seeing such a resurgence and people looking at using these off-track thoroughbreds in performance careers, what are some things to take into consideration when looking at these horses from the track?
Great question, because we do see a lot of the off-track thoroughbreds, and they're great horses, but there's a few things that certainly come to mind when I look at these horses. One, they've probably been stressed. They may have had some gastric ulcers, and so thinking about GI health is really important, whether that's a gastroscope or trying to use some tools that we have at our hands to try to figure out if they're having some GI discomfort is really important. So I always look at whether or not, or I think about, does this horse have stomach ulcers? I certainly think about joint health, and that joint health typically we'll think about maybe fetlock health and certainly hock health. I think a lot of horses coming off the track may have some hock or fetlock discomfort. A lot of these horses are going to need some time off for their feet. We talked about an foot and horse. They're going to probably need some time to rehab their feet and think about allowing that foot to grow out a bit, shaping it a little bit differently. A lot of these horses might be thin-soled and they need to have some additional support on their feet. So we're looking at some x-rays or some things of that nature. Some of these horses that are coming off the track as well. Some of the other things, two things that I think about are sacroiliac or pelvic injuries potentially coming off the track. And I also think about some dorsal impingement of the spine or kissing spine. And as I said, that's becoming more and more popular to think about. But those are a couple of areas that I also think about when looking at an off-track thoroughbred. And certainly, certainly some of them may have had some soft tissue injuries and may want to ultrasound those tendons or ligaments. And that's a little bit more involved, if you will, but certainly if there's a visual problem or historical problem that we're aware of, we may want to ultrasound the front limbs or some other part of the body. But ultrasound technique has improved greatly, and ultrasound sometimes is one of the first things I'll pull out, even over radiology x-ray. It just kind of depends on the situation.
So definitely look at those. If there's evidence or that there's a history of tendon injuries, you would want to make sure that those are resolved or in a better
Absolutely.
place.
Yeah, absolutely. So we'll typically ultrasound those limbs to look at soft tissue injuries. And ultrasound technology has improved greatly, so we're able to really look at some good fiber patterns and look at the quality and health of these tendons and ligaments nowadays. But yes, every breed may have certain things that I'm looking at a little bit more, and that's a really good question. There's off-track thoroughbreds. Those are kind of the four things that I think about.
They're coming from a very different career and lifestyle type space than simply moving a horse from one performance career home to another performance career home outside of racing. Yes. Typically do. So that was a great question. Thank you for asking that. Is there anything else while we have these great folks on that can answer any questions you might have? Anything at all that you might have? Thoughts, questions, something that might be running through your head if you're considering purchasing a horse that, you know, if you're looking for a horse for yourself or someone in your family. We did talk a lot. We've talked about a lot of topics, and each one of these could take on a whole presentation in and of itself, but we wanted to kind of give at least an overview for you to give you some ideas. But this is your chance to ask any other questions, so please ask away.
You know, just final words in the sense of use your team. I mean, certainly Katy is a great team member here in Maryland. We have such great veterinarians and farriers in the state of Maryland, saddle fitters. There's a variety of professional horse people to help you. Don't be afraid to ask them for help and to really work together as a team to find the right horse for you.
We did have a question come in asking about an average yearly ownership cost of horses. Obviously there's I feel like the answer to every question today is it depends, but maybe Katy, that's something you can address, and Dr. Sobota, maybe in terms of veterinary care, what would you tell someone who's asking or maybe thinking about buying a horse and trying to get a rough idea of what their annual expenses might be after they've made that initial purchase?
Sure. Yeah, that is a big it depends, right? Because say you're boarding, some boarding places can be $250 a month. Some places are $800 a month. So it really depends on that. You can probably plan on preventative veterinary care. Well, I'll let Dr. Sobota talk about that. But farrier care, if your horse is barefoot, maybe $50 a trim. If your horse is shod, anywhere from $100 to $400, depending on if they need pads, if they need all four shoes, and that's every 4 to 8 weeks, depending on the horse and if they need any corrective trimming or anything like that. Dental, Dr. Sobota, I'll leave that to you too. I'll leave all the vet stuff to you. There's also things like tack, blankets, treats, all the fun stuff, you know, that can really add up. A good saddle can cost thousands of dollars. Now that's usually, you know, it's a one-time cost, but that's still something to think about. So that is a really great question. And it is something that we tell people, you do your homework. It's on our application, actually. If you apply for one of the Met's horses, we ask you to do your homework and say, how much are you expecting to spend on board, on hay, on grain, on vet, on farrier, just so that we know people have a good idea of the financial commitment that they're getting into. Like I said, the cost of the horse is usually the cheapest part. It's the care, the ongoing care that can add up well into thousands and thousands of dollars a year.
I agree, Katy. Thank you very much for saying it. I'm going to maybe put it back to Dr. Burke and Jennifer and say I think a lot of your extension agents and extension research agents probably have some of this information available for you. They've probably done some work where they've accumulated some averages, and they might do it every 5 or 10 years where you're looking at certain costs for horse health care in that state. And so I know a variety of states that have probably done this within their extension agencies. So there is some information out there about that. Certainly on the veterinary side, the preventative health maintenance costs to some degree are very predictable. A lot of practices have health or wellness plans. And you can say, this is the right one for me. Either I'm going to see your horse once a year or twice a year for general immunizations, for fecal leg counts, for a good dental exam, float/equilibration. May or may not include some foot films to make sure that foot health is maintained throughout this year, and to work with your farrier to try to get that figured out. It's going to include probably a Coggins exam, make sure your horse doesn't have equine infectious anemia. And so these are certain things that we're going to have within our health plans, and a lot of vet practices now have those and are pretty well known if you look on certain practice websites. So there is that preventive healthcare costs. And the bigger picture, I think you can probably ask your extension agents or your state extension agent to help you with some of that, or look it up online.
Definitely something to think about. And I know that from the extension perspective, we do recommend that if you're thinking of getting an animal of any species, that you look into not only where and how you're going to house and keep it, but what sort of veterinary care is available in your area, who you'd like to choose as a veterinarian, and make contact with the that person or that team before you bring your animals home, certainly right away once you have, so that you can ask those questions and start to figure out what your costs will be before you get into a situation that you don't maybe want to be in, and get an idea of what your average costs might be with a different veterinary practice. We did have another question come in. Can you address a horse's need for companionship? I'm thinking of ultimately keeping a horse, one to begin with, on my property. It's a little bit different from just selecting the horse in the first place, but I guess that is a good thing to think of. Is keeping one horse alone okay for them? Is that an okay option?
Katie, what are your thoughts on that?
Horses are herd animals, and we recommend that they have a companion, generally speaking. Now, it depends on, again, it depends. Everything depends, right? Some horses are okay by themselves for a little bit. Some horses do well with a goat buddy or like a little mini. That would be okay. But generally speaking, horses do better with a friend. Just long-term health, physical, emotional, psychological, in all ways, being in a herd, even of two, is really better for our equine friends.
That was another great question, though, because I know that does come up, and that is sometimes where those companion horses, maybe those older horses or those horses who do have injuries or just situations where they can't be ridden as much, can come into play as these.
We've got a bunch available in Metz, a bunch of companion horses.
There's sometimes space for them, or the older horse becomes the companion. When it retires, it becomes the companion to a new riding horse. Any other questions? You all are asking some great questions today, and we certainly want to take advantage of these folks while we have them. I don't see anything else coming in. I don't want to miss anyone. So if you do have a question, go ahead and type that in now, so that we can get to it before we close. And we certainly appreciate Katy Whipple coming and being with us today from Metz, Dr. Justin Sobota from South Mountain Equine, to answer these questions and talk to us a little bit about how to select the horse that is right for you, that's best for you. I think we all of us that have been involved in this project, I'm sure Katy and Justin as well can both agree that, you know, when we've had those horses, that when you have the right one, it is a really great relationship to be able to have. You can really enjoy them quite a bit and get a lot out of it. But not every horse is right for every person.
Speaking back to one thing that you pointed out, Dr. Sobota, that some people go through multiple PPEs, it is worth the wait to wait for the right horse. Because you will have a longer relationship and it will be more successful with what you want to do. So it's hard to be patient, but it does pay off in the end.
Well, I think that about wraps everything up. I don't see any further questions. So it sounds like you answered most of the concerns that were coming in from today, at least. So thank you so much for that. Again, if you do have any other questions, you're welcome to contact us. I would be happy to pass your questions on later, or make sure that we can try to address and answer them, send them to the right people that can help you. That's certainly a big part of what we do with our extension program, is try to get the questions that you might have answered by the right people. Thank you again so much, Katie. Thank you, Dr. Sobota, for taking the time out of your afternoon to spend with us today. It was a great topic. We had some super questions. And with everything in the world right now in this beautiful fall weather, I know more and more people are thinking about maybe it's time that they start their horse hunt and finding that horse for themselves, for their family. So thank you for helping us wade through some of the things that we need to think about and consider in making those sorts of decisions. Thank you all so much for joining us today. Again, this video will be posted to our YouTube channel, and we hope that you'll be able to share it from there. Thank you all so much. Have a great afternoon.
Thank you.
Thank you.